Hi guys, it's Grace. Welcome back to another video for Trinity School of Medicine. I am currently in my internal medicine rotation in Southern California, and one of the most valuable things that I've been learning so far on my journey in rotations is how to write a proper SOAP note and how to present it back to your preceptor. So today I'm going to be going over a short and simple SOAP note, what goes in each category, and the importance of putting the right things in the right categories. A lot of preceptors have different ways of doing it, but I've gathered all my notes and we're going to go over a simple example today. So for example, a 47-year-old male comes into your office and his chief complaint is that he's been having burning stomach pain for about 2 months. So that will go in your subjective. SOAP is subjective, objective, assessment, and plan. So we're gonna start with the subjective. So you're gonna write down everything that the patient tells you in subjective. It's a 47-year-old male. He comes in with a 2-month history of burning epigastric pain. He describes it as worse at night and worse after meals. He reports nausea. He reports getting full quickly and occasional bloating. His symptoms temporarily resolve with antacids, and he denies vomiting, blood, black stools, difficulty swallowing, or weight loss. So that's basically everything that the patient tells you as soon as you walk into the room. Then we're going to move on to objective. And objective is basically your vital signs, your physical exam, and your labs. So you're gonna write his temperature is 98, his heart rate is 78, his blood pressure is 132/82, respiratory rate is 16, and oxygen saturation is at 99%. You take a look at his general appearance, well appearing, he's not in acute distress. You'll do an abdominal examination. You'll find that there is mild tenderness in the epigastric region, no rebound or guarding, no ascites, and his bowel sounds are normal. And then you'll take a listen to his heart. He has a normal S1, S2, no gallops, no murmurs. His lungs are normal, vesicular breath sounds, no crackles, no wheezing, and he has no edema in his extremities. And then you'll take a look to see if he's had any recent labs done or if he needs recent labs. And so this patient, for example, had labs. His CBC was within normal limits, so he doesn't have anemia. His CMP was normal with normal liver and kidney function. So then within the labs, you notice that his stool antigen test is positive for H. pylori, and he has a fecal occult blood test that is negative. So that's basically for objective. Objective is everything in your vitals, in your physical exam, and in your labs. You'll move on to assessment, that's A, and that's basically your problem list and your diagnosis. So the primary problem here is, if you guessed it correctly, H. pylori associated dyspepsia, likely peptic ulcer disease. And so the supporting evidence would be that the patient has chronic epigastric pain after meals, a positive stool antigen test, and no alarming features like weight loss, anemia, or GI bleeding. And so a lot of my preceptors like me to continue that assessment and add other possible differential diagnoses. And so you can add GERD, for example, you can add functional dyspepsia, and then gastric malignancy, and that's probably less likely because there isn't really alarming symptoms, but it's always good to keep in the back of your mind, especially with chronic dyspepsia. And then you're gonna move on to plan. Now, my preceptors loved this part of SOAP because as physicians, we're not just called to give the diagnosis and walk away. You know, we need to also give a treatment plan so the patient can get better. So the first thing to do is the triple therapy for H. pylori, and that includes omeprazole, clarithromycin, and amoxicillin. And you could tell them to take each twice a day. Now, if the patient has a penicillin allergy, you can always give a substitute of Flagyl or metronidazole instead of the amoxicillin. And then you definitely want to counsel your patient, educate them to eat smaller, frequent meals instead of one large meal. Avoid things like spicy foods, acidic drinks, coffee or alcohol, anything that'll kind of trigger that pain. And then you definitely want to schedule a follow-up. So the triple therapy will be 14 days, and then you can follow up 4 weeks after completing that therapy. They could do the stool test again or the urea breath test. If the test comes back positive, you can put them onto a quadruple therapy with a PPI, bismuth, tetracycline, and flagyl. And you definitely want to make sure that your patients know that they shouldn't be able, or they shouldn't skip their medications. They should be taking it on time every day until the medications are done. And so that's basically the plan for the patient. So guys, I hope that was a helpful video. Basically, S, subjective, what the patient tells you. O, objective, your vital signs, your physical exam, and your labs. Assessment is A, and that's basically the problem list, including the diagnosis. And then P is your plan of how the patient should get better, so treatment plan. And I'll show you guys what the full soap note looks like at the end of this video, but other than that, I will see you guys in another video. Also, a very special shout out to my friend Lucy for being featured in today's video.